Hello, I'm Nasz Rewiński and you're watching TVP World Talks, where every word matters. According to latest reports, coronavirus infections are on the rise. Some people may have forgotten about this virus, even though the deadly pandemic is just a few years back. Nevertheless, questions now arise how to best protect ourselves against it. Also, Mpox, a new virus, perhaps not so new, but then again, it is a novelty to most people, is actually a cause for concern, especially for virologists. The big question is it a calm before the storm? Are we perhaps on the verge of a new pandemic of sorts, or can it be contained quickly enough? Well, all these questions hopefully we'll be able to answer for you today with our guest, Professor Krzysztof Pyrć, virologist from the Jagiellonian University. Hello and welcome to TVP World.
Good morning.
So let's begin with the coronavirus. Some people say it's back, others say it's never been away really, it's just been brought under control. Are the latest strains more or less dangerous, and what is the best course of action for the time being?
So the first thing is that SARS-CoV-2 have never been gone, so it's still with us and it will stay with us, and that's how it is with all other human viruses. At some point they caused pandemic and later on they became endemic, and they are just infecting us every year. I'm not saying it's good, but that's how things will be. If you're asking about the new subvariants, so KP2, KP3, they are called commonly fluid. There are no signs that they are causing more severe disease, that they pose higher risk to the infected individual. However, we know that they are pretty transmissible and they are pretty good in avoiding our immunity. So they spread, and that's why we do see the increased number of cases. But fortunately for us, this increased number of cases is not translating to the severe disease so much as in early days of SARS-CoV-2. So we cannot and we should not compare the current situation to the situation from 2020 or 21. That's the same as for the influenza. We have an influenza season. It's not good. It's something that we should prevent by vaccinations. I mean, the severe disease, we should take care of the vulnerable ones, but I wouldn't say there is a reason to panic or to get too agitated.
So overall, there is a question of how to protect ourselves. First question, should we wait for new vaccines? They will be rolled out in the US, but predictably, Europe will have to wait for a slightly longer time. It is estimated that perhaps late September, early October will be the time. Do they give us a real edge over the existing vaccines?
Yeah, so the data we have now available say that they do provide substantial protection. Let's compare it to the influenza vaccines. Every year we have a new vaccine, and every year it's better than the one from the previous year. So viruses do evolve, so they change. So the virus that we're getting infected this year is very different from the one that we got last year. So I do think that these vaccines should be updated, and we should take a jab once this is available, just to update the information about the virus that is circulating now. We cannot say how effective it will be, the same as for influenza virus, because the virus is changing. The virus that will be with us in December or March next year may be different, but for sure the risk of severe infection will be limited, and so there will be a clear benefit to us. And all the studies show that this risk-benefit ratio is positive, so it's good. The benefits are higher than the risk associated with the jab. So I would say we should vaccinate ourselves once the vaccine is available.
But for the time being, the virus has a window of opportunity, unfortunately, before the new jabs are available. So would you say that the recent suggestions that perhaps face masks could be making a return, of course, not on a massive scale during the pandemic itself, but would you say that it would be the preferable option, especially for people from risk groups, to use these face masks whenever they go out into crowded public places, for example?
Mm-hmm. Yeah, I think that should be now treated individually. We are in a different situation than during the pandemic, and the face masks, the surgical face masks, they work the best once everybody's wearing them, because they are mostly the source control. So they protect me if I'm infected from infecting others, or limiting this risk. Maybe not protect, but limiting the risk. So I would say if somebody is in a high risk group, I do believe that people should have access to drugs like Paxlovid. But if well, in Poland that is pretty limited. But if they think they are in a high risk group, they should contact the doctor and ask about the situation. And if they are really endangered, they should consider wearing a mask. But I would say they should wear a better mask than just the surgical mask, the KN95 or N95, whatever is advised by the doctor. So we should first understand what the masks are for and which to use to provide protection, not to create the fake feeling of safety. But yes, the high risk groups should consider that. And then one more thing to add: if we are feeling unwell, if we are feeling that something is wrong with us, we should first of all stay home and get better. And if we cannot
Self-isolate,
stay home,
essentially.
yeah, well, it's a big word.
Well, of
Just stay
course,
home,
so.
get better. It's good for us and it's good for our coworkers, and I think it's also good for the company we work in, that not everybody is sick at the same time. But if we have to go out, we should wear a mask just to protect others. So the very simple rules, they are adopted in several places in the world, and they simply work to limit the risk.
It's always good practice. Also, glad that you mentioned Paxlovid. In some countries, like Poland, for example, availability is still limited, unfortunately. We do need to proceed to the next part of our conversation now, Mpox. How dangerous is it, really? Do you think that we should be worried about this at this stage?
So let me make one thing clear. We have many diseases that we should worry about as specialists. Mpox is one of these diseases that is entering the human population and posing a risk of spread. It's present with us already for a long time. The cases of Mpox were noted already years ago, and they were neglected more or less. And then I believe in 2022 we had the first cases of Mpox spreading in the world and spreading between people. And then we had some information that this may be a new problem, like worldwide problem. But it appeared that the clade that was spreading, that was clade 2, which is associated with lower mortality, and also its the transmissibility is limited to a very close contact. So we had many cases at this time, and then the cases went down, and everybody thought, well, then it's over. Maybe we'll see some cases in the world, but that's not really a big problem for the public health. And then what happened this year is that the second type of the virus, so clade 1, started to spread in Africa. And this clade is, first of all, associated with higher mortality, so it may pose a bigger problem. And second of all, it is believed that it may be transmitted not only in a very close contact, but also by droplets. So sitting close to the second person may also pose a risk
That's
of
exactly what I
infection.
wanted to ask. What's the mortality
Yeah.
rate? And also, what do we know about transmission? Does it transmit in a similar way as, say, the common cold or flu or COVID? Or do you actually need longer and more intense exposure when you're talking about
Yeah,
like
so if
droplets?
you're asking about mortality, I would love to give you an answer, but the problem is that most of the cases occurred in Africa where surveillance is pretty poor. So what is estimated now, it's few percent. It used to be estimated like 10%. Now I've read a report about 3%. The point is we don't really know how many mild cases there were. So the mortality may be much lower than what is reported. But for sure, that's something to be worried about. Just to remind you, the COVID mortality was about 1% and stopped the world for 2 years. So the mortality is not low, but it's also not like super high. And if you ask about transmissibility, of course, it's less transmissible than COVID, for instance. For now, you need more time, you need closer contact. The main problem is that once you get infected with Mpox, and then the time you need to show symptoms, your body needs to develop the disease. It's 2-3 weeks, and the problem is that you may be asymptomatic and still infect others. So this window of opportunity for transmission is pretty big. So that is what is worrying. You may go to Africa for your holidays, get infected, and then come back to your country, and then infect others. And that's what we see is happening in some cases. So I would say that there is a reason to be vigilant there, for sure not to panic. We do have vaccines, we do have drugs, targeted drugs approved by EMA. So the situation is very different as compared to COVID. But for sure, that's something that requires attention, and it's very good that the global authorities started to pay this attention and draw the attention of national authorities to the potential problem of Mpox.
Just a quick question now. When should we be worried, essentially, once the virus manifests itself? What are the symptoms? Does it have like telltale symptoms that make it impossible to confuse with anything else?
So I do believe we should ask a doctor if we have doubts. I mean, I'm not really a fan of this internet diagnosis or I don't know, GPT chat-based diagnosis or whatever. If we have,
of course, it's not recommended, definitely.
Exactly. If we have, we are afraid that we see some symptoms that may be associated with Mpox, we should immediately contact the medical professional and ask the person for the diagnosis, because the first symptoms are very atypical, and then we have changes on the skin, but there are many reasons for this kind of this kind of symptoms. So just to be sure that we're not harming ourselves with self-diagnosis without proper knowledge, just ask the person who should know that.
And that should perhaps be the conclusion here, that in addition not to panic, we should refrain from diagnosing ourselves, ever since going to the internet and trying to determine what is the cause of the itch that we have may actually lead us to conclude that we have cancer or something like that. So definitely do take advice from health professionals, and of course stay safe. That's naturally the appeal to everyone who's watching us right now. Professor Krzysztof Pyrć was our guest today here on TVP World. Thank you very much for joining us and for sharing your expertise.
Thank you so much. Have a good day.
And I'm Jonasz Rewiński. You're watching TVP World. Please do stay with us.